Dr. Michael Kuchera. Welcome to this international conference of the Osteopathie Schule Deutschland in Berlin, Germany. It's a great pleasure for us to have you here.
That's good to be here.
And what I'd like to do now is to spend a little bit of time to get to know you as a person and the osteopathic Dr. Michael Kuchera. You've had a distinguished osteopathic career, both as a clinician, as an educator, and as a researcher. You've spoken at many conferences and you've published books and articles. But before we get into all of that, let's go back to the beginning. I know that you are a third-generation osteopathic physician, following the footsteps of your father as well as your grandfather, dating back to 1928. And I'd like to ask you, first of all, what was the deciding moment for you when you decided to become an osteopathic physician?
I made actually the decision for totally wrong reasons. I tried perhaps everything possible not to be a physician simply because my grandfather and my father were. So I went to Iowa State University, studied, I got a BA in history and a BS in zoology, and I had minors in physics, chemistry, English, math, and music. And I was starting on a biomedical engineering master's degree, thinking, okay, I can kind of combine all of that stuff together. And then one day over summer break, I was working as an engineer designing circuit boards to help buy a car. And I was staying in my old room where my brother now was residing. I'm one of 7 children, so as soon as you leave, the room disappears. And I found myself, I had gotten up in the evening, and I was standing over my brother's bed, holding his 2 arms and crying because I didn't know which one was ground. And I figured at that point, I'm not designed to be dealing with machines. I need people. And so I went ahead and at that point decided, okay, I think I want to be a physician. Earlier on, I had thought, well, if I do become a physician, which shall I be? My father never pushed me one direction or another. And I decided, well, if I'm going to go into family medicine, I want to be an osteopathic physician because we have more tools and we have perhaps a better one-on-one communication. If I decide to go into research or become a subspecialist, well, then maybe I want to go to an allopathic school because they have bigger institutions. So I decided, well, I think I'll be a family doctor, and I picked osteopathic medicine for that reason. Totally wrong reason, but totally right outcome.
So you, when you did your osteopathic training, you enrolled at the Kirksville College of Osteopathic Medicine. What made you decide to go to KCOM?
I actually thought there's a stigma still in the United States about MD versus DO. So I should apply to Kirksville because it's the best osteopathic school. It's the mecca of osteopathy. And I'll apply to Harvard so I can turn them down and say it wasn't a second choice. But applications cost money. So I only applied to Kirksville. And it was kind of interesting because I was in the middle of pursuing a master's degree in biomedical engineering at the time. I had kind of pushed my studies quickly, so I had only been 3 years at school for those degrees, and figured, well, if I don't get in at this point, I can wait an additional year. Interestingly, I never heard from Kirksville, and it was getting late in the season, and so my father said, well, are you following up? And I said, well, they haven't contacted me yet. He says, oh, I think you should give them a call. So I gave them a call, and they said, oh, yes, well, we're missing still one letter from a reference. And I said, oh, I know that person sent it in. And they said, well, just a moment. And they went and they looked, and they said, oh, we just found it in between the 2 folders. We've got 2 positions left. Do you want to come and interview next week? I said, sure. I drove down from Iowa State in Ames, Iowa to Kirksville for my interview. and I'd never been there other than the first 4 years of my life. I was born there when my dad was in medical school, but moved away before it could affect me. And I drove into the square, and on the square, I know you've been to Kirksville. Do you remember the Kirksville College of Cosmetology?
I didn't go there very often.
No.
But...
Well, the sign was all faded, and I looked at it, and it was this little small storefront, and then there was this faded sign up above. It said Kirksville College of, I thought it said osteopathy, and I thought, oh my gosh, what have I gotten myself into? But eventually I made my way and had my interview and was accepted and graduated in 1980 eventually.
When you were a student at Kirksville, you had faculty members teaching you, which included Dr. Paul Kimberly, Dr. Edna Lay, and also the esteemed physiologist, Dr. Irving Kaur. Which role have they had in shaping the osteopathic you?
First with Dr. Kaur, he was just leaving as I was coming in, so I didn't have him as a teacher. I certainly had him as a guest lecturer when I came back and was establishing curriculum for students. And he and I worked for probably 15 years or more on the Bureau of Research. So he had a strong effect, but not as having been a primary teacher. My primary teachers, Paul Kimberly probably had the greatest impact. Tall Paul, as they called him, had arrived in Kirksville in 1975. I arrived in 76. And he was still, at that point, putting together handouts when we used to run them off on the mimeograph, which was great to smell. He was an exceptionally organized man. From his book, you can see every technique is numbered, and each one has a subclassification. And he did the same thing with how he taught and how he classified osteopathic manipulative treatments. And I think the attention to detail, when you would study from him, every single step had a specific reason. And so as you looked through the steps, if you didn't know why you would push the patient slightly away, or if you didn't know why you should add a certain amount of compression in a certain direction, then you were missing something. And so that attention to detail and that classification, which he had used for his FAAO, I think he did it on the manipulative prescription, defining things as you would give a medication. Here's the type, direct or indirect. Here's the dose. How often should you give it, and which methodology do you use to activate it? Same indications and contraindications. So it was he had a major influence on my technique and my perspective. I think Edna Lay had a significant impact on me, partially through fear.
I can see that.
my very first indirect technique at that point in the schooling, you would pick out of a bag an activating force, and you'd pick out of a bag an area to treat. And so I picked sacrum, left rotation on left oblique axis, and balanced ligamentous tension. Well, she was known for her indirect technique. Sure enough, my patient had a left rotation on a left oblique axis, and so I got my hand in on underneath the sacrum. And then I started to do as all of us students did. I said, well, what we would do is we would move away from the barrier. And so I'm going to rotate it a little farther to the left on a left oblique axis, and then we hold it until it releases. At this point in time, students usually hummed a song in their head, not feeling anything from their hands, but you had to wait for a while and look like you were doing something. So I started into that routine. She slid her hand in under mine and said, tell me when it releases. Oh my gosh, what am I going It's like the first time I learned to ski and didn't know how to stop. You learn a lot in that moment in time. And it was like, oh, it's releasing. Yeah, you're not supposed to sound surprised during a practical examination, but it was like, I can actually feel this. Why didn't I pay attention as a student? Why did it have to be during the testing? But I learned a lot from Edna at that point in time, and later on when we were working together as co-faculty, she continued to teach. But I must say, as with most schools, you often learn or appreciate the people who are teachers at other schools. I think sometimes we should all just move one school to the left and we'd all be appreciated.
Yeah, I also remember some years ago at the conference you were talking about your skills when you had finished your training at KCOM. And you said that you felt that you can do any procedure under the sun in terms of using osteopathic manipulative medicine, but you didn't have any experience or exposure to how to put this all together to do an osteopathic treatment. And then you would move on to talk about another one of your mentors, which would actually help you integrate all your knowledge into doing an osteopathic treatment, which is Dr. J. Gordon Zink.
Yes.
What can you tell me about your experiences with Dr. Zink?
Dr. Zink was probably one of the most clinically influential individuals that I had in my training. The Des Moines School, which is where my grandfather graduated in 28, was just a few hours drive from the Kirksville School. And Dr. Zink would come down for what we called Undergraduate American Academy of Osteopathy meetings, UAAO, and give us a little additional lecture and some workshop time on Saturdays usually. And so Dr. Zink came down, and as he always did, gave this tremendous lecture about the respiratory circulatory model, about fascial patterns and compensation and how you could treat it in a time-effective way. And then proceeded to teach us that. When the workshop was over, he would treat everybody in the class, their spouses who were coming to pick them up on that Saturday, the custodial staff walking down the hallway, anybody he'd get his hands on, and it was amazingly quick. He would finish each person using the common compensatory pattern and the transition zone treatments. He would spend 3 to 4 minutes tops on each one. And it was common to hear students say, well, I'll never have time to integrate medicine and manipulation and time with the patient. And watching him work, it was amazing. It was like, yes, this is something that is important. I spent a month with him on rotation and got a chance to see him treat regular patients. And while it took a few more minutes than 3 or 4, because many of his patients were very ill, he still emphasized it's the goal, not the technique. And Kirksville had prepared me very well, as you say, to treat every patient in every position with every activating force efficiently and successfully. But it took a long time to diagnose every single somatic dysfunction and treat everything, as opposed to Zink, who said, take a look for the key lesion for the model that you're using. Set a clinical goal and then go after the clinical goal. And when you did that, it became very time efficient. And so I'm sure that Dr. Kimberly and Dr. Lay and Dr. Rumney and all of my teachers at Kirksville had said the very same things. But once again, moving outside of the school walls, you got a chance to see and hear somebody else say these things. So I decided at that point, rather than go into practice for 10 to 15 years before eventually going to teaching, which I knew I wanted to do at some point, I decided this message is too important. I'm going to start teaching as soon as I have the opportunity to do so. And actually, Paul Kimberly hired me during my senior year of medical school to come back when I finished my postgraduate work and be a part of the faculty.
When we talk about teaching and some of your contributions to osteopathic education, together with your father, you have written numerous textbooks. That's Dr. William Kuchera, Dr. Michael Kuchera. And I'm initially talking about osteopathic principles in practice and osteopathic considerations in systemic dysfunctions. They're widely used all over the world as foundation texts for many students and osteopathic practitioners. I can still remember back in the 90s when I got a hold of my copy, I was clinging onto it like Gollum in Lord of the Rings, saying, "My precious," didn't want to let it go, and I still have the copy worn out. Can you tell me a little bit about working together with your father, Dr. William Kuchera, who's also a tremendously respected osteopathic physician, and how all these things came to be, combining family life, teaching, research, patients, writing?
It was the best 15 years of my life. I mean, working with my dad has been, was, and still is, the best time I spend. He's a great guy, big shoes to follow. He was actually hired the same year that I was by Paul Kimberly when they recruited me. I said, "Well, you should think about bringing in my dad. He's practiced family medicine osteopathically for 25 years, and he's kept records. About 75% of all of his patients received manipulation as a part of their total family medicine care. About a third of his practice was obstetrics, and so he had a large obstetrical and a large pediatric patient population. So his clinical experience, all of our years, I could only aspire to. He had such tremendous amount of clinical experience. On the other hand, he had trained in the lost generation, where if you found a spot here, the teaching was, well, that you put that side up and you do this set of maneuvers, but the mechanics weren't really taught. And so with my learning from Dr. Kimberly and the ability to take many of the clinical things that he was doing, we enjoyed sitting down and writing the books. And he's a tremendous medical illustrator, so he illustrated all the books, and I would write all the words. I think with the books, if you took the words out and just looked at the pictures, that's probably where the success of the book is. So he's really the master star there. He has a knack of being able to take a picture, and unlike Netter, where everything is so beautiful and so complete, he can take out the parts that are less important to the concept that is trying to be conveyed. If they say a picture is worth 1,000 words, he's written many more words than I have. And I'm a pretty wordy guy. Sorry for all of those who have read my book. Working with Dad, the students always called us Papa Cooch and Baby Cooch, and they thought we didn't know. Now I'm the one with the gray hair, but it was never a competition. It was always a project of love together to get the students trained as best we could and as simply as we could convey the information. I'm a grouper. I like to take things and put things into categories. Dad also is a person who likes to put things into steps and categories. And so hopefully our books have been helpful. But we're still working on, he's always calling me up and saying, we need to get that next chapter done. I'm sitting here waiting to draw the next pictures. When is it going to be done? And I keep saying, well, I have another job. Because he retired about the same year I became dean, or maybe it was a year before. It was 95, 96. Dad went ahead and retired. So we've been working on vacations together and that sort of thing. My dad also has been illustrating the new Foundations textbook, and he illustrated Mickey Seffinger's evidence-based book, and several other authors will give him a call to still draw the pictures. And that works out nicely.
I remember stories as well from your father practicing up in Davenport, Iowa, which is sort of the homestead of chiropractic. And I'm sure you have heard a lot of his stories, being one of the very few osteopathic physicians practicing in the Mecca of chiropractic. Do you have any insights or any thoughts on sort of general differences between the osteopathic approach to manipulative care and the chiropractic approach, without making this too much of trying to...
I think trying to classify chiropractic is difficult for anyone who is outside the field. And then, as the World Health Organization found, as they worked with World Chiropractic, chiropractic isn't one perspective necessarily. There are several different ways of looking at what a subluxation might cause, and whether it's a primary cause or a secondary cause for treatment. What I can say from my dad's experience, I told you about a third of his practice was obstetrics, and being in a college town where the World of Chiropractic, it was the name of our radio station, WOC, and the founding chiropractic school, Palmer, had put together, being in Davenport. My father saw a lot of the chiropractic students coming to him saying, we would like to have you be our obstetrician, and because we know that you're going to integrate manipulative care along with everything else that you do. And here's our list of things that we don't want to have done. And he would look at the list and he said, well, this one's state law, and this one is a necessary piece for every delivery. This one I won't use if I don't need to. However, if such and such a situation would arise, I will use this, and I can't take your case if you're going to tie the ability to give good care. He said, that aside, I will go ahead and provide, as I do with all of my patients, manipulative treatment to reduce your back pain and to help your process through the development of changes of gravity, and should make the delivery easier. He had a lot of stories about his starting with patients in general. And many of the chiropractic students then had him as their primary care doctor, and treating the babies afterwards, and so on and so forth. I was at an international conference once on low back pain in Montreux, Switzerland, and we were riding for the social evening up on a Belle Epoque train to the top of this nice place for a meal. And in the club car right in front of me, as a member of this overall conference, were two of the most attractive people I'd ever seen. They were from Sweden, attractive people from Sweden and from Norway. But I got to talking with them, and they were part of the conference. And I said, well, where are you from? We're from Sweden, but we went to a school in Davenport, Iowa. And I said, oh, my father practiced in Davenport. And they started talking more, and we had introduced ourselves, but I guess they didn't catch my name, because later on they were saying, well, our obstetrician was an osteopath in Davenport, and who was it? Maybe I know him. And they said, well, it was Dr. Kuchera. And I said, oh, and they pull out their billfold, and here's our 16-year-old son and our 15-year-old daughter, and he take these and give them back to your father. And it's a very small world.
It's a small world. I'm pretty sure if we look back at your life, we could say that you really had an osteopathic life well lived. And I know that you have so much still to give for years to come. But are there any very significant moments in your osteopathic career you'd look back to and really treasure?
I think the community of the osteopathic profession, we're a family. When I started at Kirksville, I went my first year to the American Academy of Osteopathy's convocation. At that time, it was held every year in Colorado Springs. And I arrive, and one of the first people that I meet is this elderly woman who says, "Oh, I see from your badge that you're from Kirksville. May I take you out for lunch?" And there were a group of 4 or 5 of us, and we said, "Sure, students will never turn down free food." And what is your name? "Oh, my name is Viola Fryman." It's like, the Viola Fryman? Because Edna Lay and Viola Fryman had been very prominent in the California merger and getting practice rights back, and so I had heard about her even as a first-year student. And, it's kind of, we're not worthy. But every year she would take a group of Kirksville students out for meals and share philosophy and share thoughts about what it is to be osteopathic. And about every year, she took me 1/2 step farther along in my ability to accept blindly what she was saying. But by the next year, that had processed, and I was ready for the next installment, if you will. When I got married, during my between my second and third year, one of Dr. Fryman's patients gave back to osteopathy by funding 6 Kirksville students to go out to La Jolla, where she practiced at that time in California, and spend a week with her, studying anatomy, studying her patients. And so got married, went off on my honeymoon. We flew back to St. Louis. My wife drove home alone, and I went off on the plane to the other woman, which is what she called Viola for the rest of till Viola passed. But that week in La Jolla, spending time with several of my classmates, with one patient, but 7 sets of hands on a different part of the patient, and getting a chance to see what happens when somebody over here does a little something subtle and you can feel it all the way down here. The concept of the body unity was reinforced with the time with Viola. And then after patients, after 12 hours of seeing people, we would have dinner, and then she would have an anatomy session. And the anatomy session would be, okay, trace the facial nerve from its nucleus in the brain through all of its routes into the sphenopalatine ganglia and on into its distribution. Go for it. Every hole, every pathway, and it's like, oh my gosh. So again, she reinforced structure function. She had a music therapist playing at the same time as she was providing her treatment, and talked about entrainment and approaching patients whose nervous systems might be more agitated. So start with some fast music and work your way slowly into some slower music, and kind of catch the wave of the patient and move them to where it is that they could best function. So I think that was one of the, again, clinical mentorship, reinforcement of osteopathic living that came from, one, an individual, Viola, but also from the American Academy of Osteopathy, because it was filled with those types of experiences. When I became president of the American Academy of Osteopathy, my thank you acceptance speech was basically titled, "I'm a child of the Academy." And yeah.
So up until now, we've talked much about the past, which is still present in you and has led to what you are today. If we're going to close off this discussion, What would you like to see in the future for osteopathy and osteopathic medicine? What is sort of your vision?
Well, it's exciting. When I left Kirksville, as I had been dean, I had been chair, I'd done a lot of the teaching. There was a new chapter offered to go to the Philadelphia school and set up research. And so for 10 years, we set up a DO master's program. And I was fortunate enough to work with the Department of Defense and others who would give us equipment where we could use high tech to study high touch. So everything from inter-examiner reliability studies to measurement of nitric oxide as expressed through eNOS modulation, doing lymphatic pumps, to looking at distribution of arterial, venous, and cerebral spinal fluid within the cranium were things that we got a chance to do in Philadelphia. Now that I'm at Marian University, which is a new institution, we're just getting to the point where they're saying, okay, we've got accreditation, let's now move forward and take a look at research. In fact, the dean this year has said research should be our next first priority. My hope is that I'll last long enough to be a part of setting up again research at my institution. And I hope that the entire profession does the same sorts of things, expanding research at the institutions, because we're just now getting to the point where we've got the instruments that can begin to measure some of the subtleties that we can do with our hands. And we're just now, with people like Paul Stanley and his discussion of mechanotransduction, looking at how counterstrain isn't just simply relaxing a muscle and relieving pain, or relaxing tissues through which fascias have to drain. The changes that take place at a cellular level to decrease inflammation, to modulate interleukin production, these are the sorts of things that can move osteopathy from a 125-year-old concept, which had outstanding empiric results, to a valuable, it's valuable to begin with, but an even more valuable contributor to the understanding of how the body works towards health, how the body's musculoskeletal system works towards health, how everything that we are, mind, body, spirit, may have a role through things like polyvagal elements and modulation of the autonomic nervous system towards health. So all of the concepts, mind, body, spirit, structure, function, self-healing, self-regulating mechanisms, go back to how can we as osteopathic physicians, osteopathic practitioners, osteopathic believers construct a treatment for patients to have better lives. That's my hope.
Well, thank you very much for your conversation, for your time, and for your contributions to our profession. And now I'll let you go back to enjoy the conference.
All righty.